Now, those who are most impacted by COVID-19 are people with pre-existing conditions. And one of those conditions is obesity, which the United Nations calls a pandemic in its own right. Joining us now to discuss the link between obesity and coronavirus deaths is Peter Coy. Peter is economics editor for Bloomberg Businessweek, who's been looking into this. Peter, get us started by explaining why obesity and COVID complications are so inextricably linked.
Well, it seems that obesity is linked to impaired immune function. Your immune system can't fight off the disease as well. Another factor is that obesity decreases your lung capacity, and if you have to go on a ventilator, it's harder to get the ventilator to work. So what we see is that obese people who are diagnosed with COVID-19 are more than twice as likely to be hospitalized as non-obese people, and they're 48% more likely to die. So yeah, there's definitely a strong connection there.
There's definitely a strong connection, and it's particularly concerning for the U.S., where obesity is a much more prevalent problem than elsewhere. Where does the U.S. rank versus other countries?
According to World Health Organization data, the U.S. is 12th in the world, and it's actually, that number is worse than it seems because 10 of the countries ahead of it are very small Pacific Island nations where almost nobody lives, plus Kuwait. So in the U.S., 42.4% of people, adults that is, were ranked as obese in 2017-18, obese being body mass index of 30 or above.
Yeah, so we're first among the rich countries of the world.
Yes.
How does the wealth gap play into the obesity epidemic here in the U.S.?
So it's true that poor people are more likely to be obese, and there are really two reasons. One you hear about a lot is that, convenience food is just cheaper, more easily available. And that kind of food is more likely to be loaded with salt, fat, sugar, accounts for more than half the consumed calories in the U.S. as well as the U.K. Vegetables and other healthy foods can be more expensive. A second factor is that money problems cause stress, and stress causes bad eating habits. Think about it. You have a certain budget of willpower to get you through your day. So if you're spending it just trying to make ends meet, you don't have any willpower left for maintaining a good diet.
Yeah, then comfort eating becomes the result.
Yeah.
So can anything be done at the federal level to address the root cause of obesity, or solely the purview of state and local governments?
It seems that most of the action these days is by state and local governments as well as the private sector, non-governmental organizations. So I have to make a disclosure here. Michael Bloomberg, who is a majority owner of our company, is very active in this space, as you may know. He's funding the Trust for America's Health, for one thing, which one of the things they're doing, which is very positive, is trying to provide more, recommending fighting obesity with free school meals. That's one thing the government can do, and expanded access to food stamps so people have the money they need so they can buy healthier foods. And there's other things like disclosing calories on menus so people know when they're eating unhealthy foods. And then you have issues like taxes on sugary drinks, which already exist in a bunch of companies, Mexico, Philippines, as well as some cities in the U.S. like San Francisco and Seattle. There are a lot of things that can be done.
Yeah, clearly obesity is an economic issue. So let's tie it back to your day job. You write about economic issues, the cost of solutions. What's the cost of obesity to the U.S.?
Well, one number I saw in my research for this article was that about $149 billion annually in increased health care spending, about half of that paid for by Medicare, Medicaid. There are also effects on the military because having obesity is the most common reason that young adults are ineligible for military service.
All right. All things to keep in mind here. Peter Coy, really appreciate it. Peter Coy of Bloomberg Businessweek.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.